I cannot understate just how much of a role genetic factors play in autism, that is very strongly related to genetic factors. But it's not always something that's obvious to people. The more similar your genetics are with another person, the more likely you are to have autism, just like that other person. Twins have the highest risk. Identical twins have the highest risk of both developing autism.
Hello everyone, this is Dr. Anita Lwanga. I'm here with my friend Dr. Vlad. I'm sure you guys remember him. We had talked to him about autism last time, and he graciously agreed to come back and to share more information with us. For those of you who have family members or children with autism, this is going to be a fantastic episode to listen in on and to even share with your friends and your family. And even if you don't know anything about children that have autism or ADHD, I think we should all be aware. We should all learn and we should all grow. Listen in on this episode, even if you don't think it's relevant to you. I think it's extremely important for everyone to be well aware and to be knowledgeable. So Dr. Vladimir Barayev, I'm going to introduce him again, is a board-certified pediatrician with extensive experience in developmental care, and his particular focus is on autism. He's based in Staten Island in New York. So all of you who are from New York who are watching, I don't know how many of you are from New York. If you have a family member with autism and you're looking for a doctor, Dr. Barayev is the doc that you need to find. And we'll make sure to have his website and all the ways you can contact him in the show notes below. Dr. Vlad, we were just catching up. It's been a while since we had a chance to talk. So can you briefly remind us how you got into pediatric developmental care?
Well, Dr. Anita, it is a pleasure to join you here today to speak with your wonderful audience. And for me, I started my interest in the field of developmental pediatrics around the same time that I started practicing pediatrics in general. I just happened to notice there was a great gap in the ways that family felt heard, understood, and supported, particularly for kids with special needs, kids with autism. Like, a lot of the information was locked away in subspecialist offices that people don't always have access to, aren't always aware of their options for support. So I figured doing it from a general pediatric standpoint helped me disseminate information out further. And autism is such a fascinating field. Developmental pediatrics is a fascinating field. We're constantly learning more about children's behaviors and their relationships with parents and how we can best support them to have a brighter future.
Oh, that is amazing. And I love your heart to disseminate information and to make sure that people have more exposure and more understanding to the information that they need to help their loved ones. You're right. A lot of the information that we have these days, like, there's so much information. And in medicine, I notice this trend as there's more information, people subspecialize and subspecialize, and not everyone will have access to these, subspecialists and the information that they have. So I really love your heart for children with autism and ensuring that their parents have access to the right knowledge. And with that in mind, what do you think is the most rewarding part for you or thing for you in terms of working with children with autism?
Getting to watch their progress and development over time. I find it hard sometimes to recognize kids when I see them 6 months or 12 months after I initially meet them. See all the progress that they've made, all the gratitude that families feel towards me. I'm not always cognizant or aware of it in the moments, but afterwards, when they come back to me and give me their feedback, how much the work that I do has affected their child's life and their family's life, it's always been eye-opening of just how much of a difference you can make by simply listening to people and helping guide them in the appropriate direction.
Oh, that is fantastic. And I think that brings so much hope to people, because I think not only for me as working with adults, I can understand the perhaps despair and the different stages of almost grief that people go through, and even depression when they get a new diagnosis. And it's so easy for people to feel like I have to just take medications or I have to just do this and things are not going to improve. But I'm happy to hear that with autism, there are ways to help people. There are ways to help the child. And I'm very surprised, but I'm also fascinated that you say that the support and the help that you give your patients is so helpful that you sometimes don't even recognize the children when you see them a few months later. That is fantastic.
Yeah, absolutely.
Could you tell us a story? It doesn't have to be like identifying, but even one situation or one scenario where the child was this way and then X months later, these are the things that you noticed that made you say, wow, who is this?
Yeah, absolutely. I can think of a wonderful example. So there was a child whose family was struggling with helping them to control excessive eating of like high calorie foods. And this young child on the autism spectrum, their weight was growing really rapidly, far more rapidly than expected for a healthy child. And rather than making it a pain point for the family, we just worked on weekly meetings and talking about the obstacles that get in the way of making changes and how you can't just talk to a child who has delays, who may not understand exactly why they need to eat a certain way. That if you just create environmental changes and incrementally, little by little over time, this was over the course of 6 months that I was having weekly meetings with this one family in particular. And they came back and the child lost like 8 pounds, was growing, and a lot of their, as would be expected for other kids as well, a lot of their behavioral problems improved as well, and they became more verbal, more cooperative during our clinic visits. They became more comfortable with me. So I was really impressed to see all of the changes and evolution of the child's behavior, and just their physical health improved, and the parents' confidence in being able to make changes that are lasting changes for the child.
That's fantastic. And if you just think of the trajectory of that child's life, if you had not intervened and talked to them, like, and their parents did not seek out help, what would be the future for that child? Not only struggling with autism, but struggling with their weight and their health and having other associated conditions with it. So that is fantastic that you were able to intervene at this point in time and see such a difference in a short period of time. And speaking of, you mentioned that they modified this child's diet. Do you think diet may play a role in modifying or modulating how severe some children's autistic symptoms may be?
I think there's no one size fits answer for dietary changes for all kids on the spectrum. Our diets have a very complicated relationship with our physical health, and that's mediated by our gut microbiome, and all those wonderful organisms that live inside of us. That I listened to a recent discussion of a study where they found that when some individuals go on a low folate diet, for example, like the diet has no folic acid in it whatsoever, the gut bacteria start to ramp up and produce more folic acid to subsidize that, so that they don't develop deficiencies. That is fascinating. That's something that we did not know about in the past and understand about how much our gut microbiome plays a role. Now, the word diet is a very loaded word because overall, the one commonality, I think, amongst all people that we see benefits, no matter who you are, no matter what your health status is, having a whole food, plant-based diet is probably the best way to go, because having a whole food, plant-based diet fills you up with plenty of fiber, and having plenty of fiber helps you mature and cultivate a very healthy garden of healthy gut bacteria, viruses, yeast that live inside of us all the time. And from that standpoint, having that healthy flora inside of our guts produces optimal health. There will be some people who have sensitivities to some products, not others. It's a very personal thing. You got a trial and error type of thing with the different food types. There's some people who have lactose intolerance, what have you, et cetera, et cetera. But having said that, I'm going to get into the weeds a little, but I apologize because you triggered me.
No, we love it. We want all the information that
there is this misguided notion that just won't go away. It's like a zombie myth about autism, that somehow there is a leaky gut and a conversion of certain dietary products that become toxins to the brain from things that are dairy foods and foods that have gluten in them. And all of the data to date that has experimented on that specific question, taking the placebo effect out of it, taking our perspectives out of it, just looking at, if we don't tell you that we're giving you gluten, but we really are, or if we tell you that we're giving you gluten and we're really not, what is the effect on your behavior when it comes to autism? Zero correlation whatsoever. Controlled design. To date, that's what we know. When we take the human interpretation, right, that's the whole unblinding of information out of the equation. That's what the bottom line is, that dairy products and gluten products have no correlation on the behavioral symptoms of children's autism on the whole. I'm not talking about specific individual cases, but on the whole, as far as our understanding of human biology and nutrition.
With that in mind, you touched on a number of things, and I want to backtrack a little bit. You were talking about, specifically, they found that certain children's gut microbiome produces folic acid. That is a very fascinating idea or concept. So, with that in mind, do you think children with autism should be taking a folic acid supplement? Is that beneficial? And or do you think children with autism should be taking certain probiotics?
Good questions. So to go back, the question of the production of folic acid in the gut, that was actually a study done on people who were experimenting with a carnivore diet. These two researchers, they were adults. That was not related to children.
Okay.
It's very easy to conflate topics of the relationship with folic acid and different conditions. But the fact that you have brought it up, so I'll take the probiotic question first.
Okay.
Do probiotics currently, as we understand them, like different probiotic supplements or products, have an effect on children's behavior with autism? The answer is, from the research that we have to date, no. There's
Okay.
no proven correlation between changing of behavior with a child who is on probiotics versus not on probiotics with regards to their autism. So as of now, could that change in the future? Of course it could, because we're understanding the microbiome more every day. And with advancement, so as of today is what, July 10th, the year of our Lord 2025. That's where the information stands at. Would I recommend a probiotic supplement for someone with autism? I would not blanketly, or once again, taking unique individual people and unique cases out of the equation, just as a whole, not the answer. Folic acid metabolism. There was a theory that was proposed, and is being more research has been coming to light. Now we have, last I counted, 6 randomized trials that have evaluated the effects of giving supplemental form of folic acid called leucovorin, which is folinic acid, for children with autism. And the findings have been modestly positive. I wouldn't say they have been life-changing for people who take like it's a miracle cure, but they have been modestly in the positive direction. So I have conversations with families that I work with to discuss these findings with them. And the basic approach is that there is a percentage of people on the autism spectrum who have antibodies that prevent their body from absorbing folic acid from the blood into the brain, has to cross the blood-brain barrier. You can bypass that with using another receptor that could transport folic acid, but it's not going to be the same version of folic that we get from leafy green. I can't eat more spinach and it'll push the folic into my brain. It's not going to work. There's an alternate form of folic acid called folinic acid, which is man-made, and it has been FDA approved as a medication here in the United States and around the world. But here in the United States by the FDA for treating the side effects of chemotherapy. When someone is on methotrexate chemotherapy and they're having adverse reaction, they take leucovorin, called leucovorin rescue, to help them with those side effects. That leucovorin also happens to use an alternate way of getting into the brain of children with autism. There have been some positive findings improving their language and behavioral symptoms. Preliminarily, early studies, not quite as robust as we would like to see, but we're never lucky enough to get robust, large amounts of data in pediatrics anywhere. We're used to working with a lot of preliminary stuff. The problem with working with preliminary findings is they can be overturned over time as you have larger data sets with more people enrolled. So with cautious optimism, I say it's maybe worth trialing it in a physician-supervised, controlled environment, understanding that the long-term effects of using leucovorin for autism are not really known. The adverse reaction from the research study, there don't seem to be many adverse reactions, but there's always a possibility of adverse reactions that are not reported or not documented. These are the conversations that I have with families to explain to them that it may be helpful to you, it may be useful, but it's not going to be like a life-changing form of treatment. And all the kids in the research studies that were taking leucovorin or folinic acid, they were also getting the most important form of therapy for them, which is behavior therapy. They were all getting ABA therapy, or they were enrolled in programs that used TACCH methodology, which is a specific way of educating children on the autism spectrum to make sure they make advancements and progress. So keeping in mind that kids that took folic acid and kids who didn't take folic, both had improvements. It's just that the ones on the folinic acid supplement had slightly more improvements in their skill sets than the ones who went on. So there may be an important role that folic acid plays. And as we learn over time, there may be a role that it can play for women during pregnancy before a child is even born to help with the development of the brain, because folic acid is critical for brain development. children, and it may be implicated in that as well.
Wow, that is so fascinating. And I have more follow-up questions for you. Maybe the first one I'm going to jump on before it leaves me is, have they done any studies to see if women's prenatal care, say if they haven't had a robust, we'll call it robust prenatal care, are they more likely to have children with autism? Do you know of any kind of study? Because
I don't know. Yeah, I haven't heard of any linkages regarding prenatal care and risk of autism directly. We do know that lack of prenatal care does increase your risk of overall adverse outcome for kids. We do know that there may be a slight increase in the risk of autism if your child was born extremely premature, and or if you had gestational diabetes, if there was very low birth weight. So lack of prenatal care can increase those other factors which can be associated with autism. I want to frame our conversation to something very important with regards to autism. There was a recent announcement by the CDC about the rates of autism in the United States on average. And the announcement showed that like every 1 in every 31 children are on the autism spectrum. That's roughly like 3% of the population. So that number is much higher than what was reported in previous decades. And a lot of families and parents ask the question, well, why is that happening? What is rising? There's actually unpublished data that was presented at a scientific conference this year. This is brand spanking new. It's going to be published at some point by the end of the year. Just can't wait for it. That showed the majority of the rise of cases of autism. So autism, based on the level of support an individual needs, whether it's full-time routine care or being independent and going through life with minimal support, we classify autism in levels based on how much support an individual needs in their daily lives. The majority of the rise of cases from, let's say, the 1980s until now has been individuals with much milder forms, much less support necessary. And the more intensive support needs individuals, those are pretty much flattened out. Those are plateaued over that same time span. Those numbers have not increased. So the question is, why is that? Why are there so many more individuals being identified with much more mild symptoms? And it comes down to awareness and the definition of autism. Before the year 2013, when the DSM criteria were readjusted for the DSM version 5, that's Diagnostic and Statistical Manual that providers use to classify different psychiatric conditions, there was a diagnosis of Asperger's syndrome. That does not exist anymore. So any individual who would have been classified as Asperger's syndrome is now under the autism spectrum. Because
I did not realize that. Wow.
The spectrum. So if you take every person who previously, let's say you change BMI metrics, right? Right now we have BMI, everyone over the 85th percentile BMI for children, or everyone who has a BMI over 30 for adults considered obese. Let's say we change that criteria and we made everyone with a BMI over 25 is considered obese. The number of people with obesity has gone up overnight. And then you put on the news discussion of obesity every single night. Everyone's going to be looking for it. Everyone's going to be searching for it and checking their BMI. There's so much more information available now than ever before. And it's a positive thing because that means that more minorities, more women, more people who were excluded from obtaining a diagnosis and receiving the proper support are now getting those diagnoses and now are getting that support, improving their lives for the better.
Thank you for clarifying that, because that was one question I did want to touch on. Why do the rates seem to be going up? But thank you for clarifying that it's awareness plus reclassification. And who knows what's going to happen next. I don't know when the next DSM manual is due, but then maybe the numbers will go down. We'll have a new diagnosis, or the numbers will continue to go up. So that is extremely fascinating. And there's a number of questions that I still want to back up and ask you. So you mentioned for autism, like the most important treatment is undergoing, I think you mentioned therapy. You mentioned different kinds of therapy. So tell us a little bit more about that. I'm very curious. What does this kind of therapy look like for a child? And how long do they need to undergo therapy? Tell us more.
Excellent question. So the mainstay of therapy for autism, for young children who have significant challenges in particular, is called applied behavioral analysis therapy. And it's a framework, but it has many subtypes of ways that it can be done. It can be done in a very rigid format, seated at a desk, or it can be done in a more flexible format, playing on the floor. And basically what the framework does is it uses the ABC principles. So you have an antecedent, which is something that came before a behavior. B is for behavior, and C is the consequence. Before the behavior itself, and the consequence reinforce the behavior. And this is how we learn. We learn to repeat behaviors that are rewarded and to not repeat behaviors that are ignored. So it uses those principles to a neurotypical child can learn things in a more naturalistic environment without being explicitly taught things. They can learn through observation. Children with autism struggle with that, learning through observation. They do things their own way. So in order to teach them directly versus expecting them to just pick things up as a neurotypical child would, you break down a skill such as pointing to ask for juice, right? When you're like 2 or 3 years old. You break that skill down into multiple components and steps, and you start shaping a child's behavior using appropriate consequences or rewards to help them be able to point. So you start by first looking at the object, then by just lifting their hand up towards it, then starting to form a pointing. And then the child learns little by little over time that if I point, I get what I need. And they acquire that skill and other skills that same way. One of the controversies with ABA is in the past, it was not done in a neuroaffirming way, which many therapists have now learned from and no longer do that. So neuroaffirming meaning that there are certain characteristics of people with autism that are not pathologic. They're not causing any harm to the person, and they're not causing any harm to society. There is no need to cure or fix those things. For example, lack of eye contact or harmless stimming, such as flapping their hands. Right. In the past, ABA therapists would try to teach those behaviors out of a person, and that caused significant distress in people because they were uncomfortable suppressing those urges to do certain things, or they're very uncomfortable making eye contact with people because it feels very intense to them. They feel like almost a burning sensation in their eye. So these days, I advocate and I tell parents, make sure that we're doing things that we're trying to accomplish goals of learning skills without changing the character and nature of who your child really is on the inside. If they want to not make eye contact, if they want to leave them alone, let them do it. We're not going to teach the autism out of them. They are always going to have autism, whether or not those symptoms are expressed to the outside world, whether they're just something that the way they process information in the world internally, what we call invisible disability, right? It may be something that they process internally that everyone outwardly can't see. That will never change. You will always be that same individual because it comes down to the structure of your brain. We know for over a decade that autism brain formation is a process that occurs in the womb. So a person is born already with the brain structure for an autism personality trait. They don't develop it after birth. There can be things that change the trajectory of those types of behaviors afterwards, but the embryologic formation of the layering of the brain layers that are associated with an individual with autism happens in the womb.
Ah, okay, that is so fascinating, very fascinating. And actually, I still want to back up to something that you mentioned. You were talking about studies when we're talking about folic acid, and I think you talked about studies comparing children who were undergoing therapy with folic acid and therapy without folic acid. Are you involved in any research? Maybe that's the first place I'll start. Are you involved in any research for children that have autism? And if not, for parents who feel like they don't have a lot of options and they'd like their child to be enrolled in clinical trials, where would you suggest that people look? Is there a society for children with autism or their families where they can get more information?
Autism Speaks has some information. I am not involved in any clinical research myself. There is also the Autism Science Foundation. Their website has some information for families about seeking enrollment in clinical trials, and I strongly encourage consideration for that. There's also the SPARK, SPARK is an organization that will do clinical trials and, more importantly, genetic testing. And I cannot understate just how much of a role genetic factors play in autism that is very strongly related to genetic factors. But it's not always something that's obvious to people. So genetics is a complicated term. Meaning, my child has autism, but I don't. So how can it be genetic? That's not what we're talking about. It's a complex features of genetic factors that can predispose a child to being on the autism spectrum. How do we know that? Is because the more similar your genetics are with another person, the more likely you are to have autism, just like that other person. Twins have the highest risk. Identical twins have the highest risk of both developing autism. If one of them has it, it's much higher than the other one will have. More so than non-identical twins. So the likelihood is higher amongst, and more non-identical twins, higher than two siblings. If you have an uncle or a cousin, you have 4 times, with autism, you yourself have 4 times the risk of developing autism as well versus the general population. So it's very strongly genetically linked. And the name for conditions that we gave to people in past decades, now keep something in mind. The term autism only really came into use in the 1950s and 60s. Prior to that, there was no such real term. There were individuals were classified as having schizophrenia or bipolar disorder or psychosis or being possessed by the devil. So this is all a relatively new terminology, a way of describing the experiences of individuals on the autism spectrum. So we are still getting comfortable with understanding autism. It's not a done deal yet. We're still working on it. But we're working on it in a way that's compassionate to people who are living with daily struggles and have a hard time expressing those struggles without trying to put undue pressure and pain and suffering on them just from our misunderstanding of what is actually going on in their minds.
Very fascinating. So have we to date identified any specific genes that, okay, good.
400 of them, but they're not monogenic. So it's not one gene mutation that will cause autism. It's an interplay of multiple genes.
Wow, that's a lot. Wow, the times we live in are fascinating. So I think it totally makes sense for people.
As a matter of fact, since you brought it up, every child who has autism diagnosis without a known etiology, like this idiopathic autism diagnosis, it is actually recommended for them to have genetic testing done to see if they have one of the known mutations associated with autism. And that's what I do in my clinic. So yeah, I recommend that families do consider genetic testing for children on the spectrum to see if there are, just as the professional societies in the United States have recommended, to know if there is a gene associated with their child's autism that they possess in order to give them more information about prognosis and about possibility of other conditions that could be associated with autism, such as heart disease or kidney disease down the road.
Oh, so that's interesting. So we have found that there is a link between autism, heart disease, and kidney disease. Am I hearing correctly?
Depending on if an individual has a certain genetic mutation, yes. Okay. Not in most cases, though. That's not the case.
But the fact that we have this information, it's like we've just hit the tip of the iceberg, I suspect. Like just the fact that you named this 400 genes, it's like the rate at which information is proliferating is fascinating. It's very difficult for us to keep up, but at the same time, I also think the rate at which we're doing research is also going faster. So I think that the future is very bright. There's a lot of information, and who knows, maybe certain genes will be able to either figure out how to give certain treatments for it. And I think this is also a bit controversial, but I know for sure with sickle cell, they're already doing almost like gene editing. So again, this is a bit controversial when it comes to something like in children and autism, though for children with sickle cell, yes, they are basically giving them treatment to get rid of sickle cell. So I think we live in very interesting times. And we have been talking for a while, and I still have so many questions. I think I have to have you back for a third episode. But the last question, I think I'm going to try sneak in. You talked about neurotypical and non-neurotypical. I don't know if I'm using the exact right terms.
Neurodiverse.
Oh, sorry. Thank you. Neurodiverse. I need to work on my terminology. So neurodiverse. And I've heard a lot of people use that term when they're talking about ADHD. Is there a relationship in between ADHD and autism? And if so, what are the implications? Perhaps maybe that's a better question.
Yeah, so the term neurodiverse refers to any individual, not only individuals with autism, but any individual who has a divergent path of typical development of their brain, their social skills, their language skills. That includes ADHD. So people with ADHD are considered in the neurodiverse population, as well as people with autism and others. So the connection between ADHD and autism, so there is a high correlation between the symptoms of a child who has ADHD and the symptoms of a child who has autism. Sometimes, depending on the case, it can be difficult to differentiate the two of which diagnosis a child actually carries. In many instances, children with autism also have ADHD. So the gold standard test that we use is called the ADOS, to look at the behavior of an individual to see if they meet the criteria for being on the autism spectrum or not. And if you have a person who just has ADHD, they may meet the autism diagnostic criteria too, but they actually don't have autism, they just have ADHD. That's how interestingly linked those two conditions are. But it's important from a support standpoint, figure out what's leading the difficulties that an individual has. So there are some people who have ADHD and autism that do not respond to the same treatment as a person with just ADHD to help them with focus and with impulsivity. So it becomes a very case-by-case approach to helping support optimal lifestyle and development in those individuals. The intersection between ADHD and autism is very fascinating.
Yes, it is. And it sounds like some of the treatments may, if I'm not wrong, may overlap. Specifically, I'm assuming the therapy component may overlap a little bit or not necessarily.
So it's interesting. Although it's not standard to use it in this way, a child who's getting ABA therapy or has ABA methodology for autism can also support children who have ADHD symptoms too, and helping them with their challenges. And we use stimulant and non-stimulant medications as one of the first lines of treatment, in addition to behavior modification approaches, environmental changes, and through counseling and through parental training and all those things. Medication not alone, plus environmental changes for individuals who just have ADHD. And when it comes to autism, sometimes those same medications work great, and sometimes they have to be modified.
And I can see that your work requires a lot of, first of all, patience, and I commend you for that. Patience, and also get to know the child as an individual, because as you mentioned, the treatment that might work for another child who has similar symptoms is not going to work. So I really commend you for that. I can see you really have the heart for taking care of children with autism and getting to know them, and then getting to know exactly what kind of treatments they would or would not respond to. That is so incredible. That is so incredible. And I want to respect your time. I'm going to sneak in one more sneaky question about ADHD. So I've always wondered, ADHD, we say this is attention deficit. So if somebody, I don't know if that's technically the way we should be looking at it or that's the right terminology. Why are we giving people with ADHD stimulants? Wouldn't that cause or make it more difficult for them to focus and accomplish their tasks? I've always wondered. That's a question that's always burning in my mind. Please fill me in.
An excellent question. I would love to fill you in on that. So although it's called attention deficit hyperactivity disorder, it's not really a deficit of attention. What happens is, you can imagine a light beam that instead of shining a light onto one spot, it's diffuse and shining a light. So your attention is divided amongst many things all at the same time. And what a stimulant does is it focuses that light beam into a single point. However, I would tell families all the time, while stimulant medications can help you focus, help your child focus, we can't guarantee that they'll always be focusing on doing things that are productive. They may be focusing on doing things that are not productive sometimes. And that's where the environmental changes in behavior therapy comes into play to help them, God, now that you're focused, and we're going to focus you in this direction towards more productive behaviors and approaches to living. And part of the answer is, so we're learning it's not the full answer, because we thought it was only dopamine that was responsible for the lack of focus and attention in individuals with ADHD. But there's also a role for serotonin, and I believe even norepinephrine that plays in ADHD, because there are other medications which deal with the sympathetic nervous system that affect a person's ability to focus and function. So that's basically how stimulants work. It seems paradoxical. You think of caffeine as a stimulant, it would make you very hyper, make you very jumpy, give you many thoughts at once. Whereas these stimulants, what they really are stimulating is the release of dopamine so that the neurons can fire better. And rather than having a dispersed signal in your brain, thinking about many things, you think about a focal single.
Thank you. That's always been a burning question in my mind, but thank you for being patient with me and taking the time to answer that. It's a misnomer, and there's more at play than just a deficit of attention. There's a deficit of certain neurotransmitters. So thank you so much. Dr. Vlad, I have to have you back. I still have too many questions that I want to ask, and I'm sure our audience would love to learn more. But for those of us or our audience who's watching in Staten Island in New York, if you have a child or a family member with ADHD, they need a doctor to help them. Please check out Dr. Vlad's website. We will make sure we have his website and contact information below. But we will have to have you back again when you have time. But thank you again for taking the time to talk with us.
Oh, it's been my absolute pleasure. I could talk to you for days. You are excellent at asking the right questions, the incisive questions that everyone has on their mind, but is not always able to ask or remembers to ask. I really have enjoyed my time here speaking with you.
Thank you.